My name is Mukelule Amanya from Kenya Medical Training College, Kakamega. I'm here to present to you a survey that was done in my college, Kakamega MTC, on collaboration in interprofessional education among teachers, students at the Medical Training College, Kakamega, Kenya. First of all, you need to know what interprofessional education is. And from our previous presenters, we know that interprofessional education is about learning with, from, and about each other. So interprofessional education transcends the uniprofessionalism or uniprofessional education and even the siloed approach to education. It requires interaction, there is willingness. It actually emphasizes much on interaction so that it is not just grouping a number of professionals together in a class and then teaching them. They have to learn about each other, from each other, and about each other. And this way, they'll know what each profession does, what they are capable of doing, and what they can learn from each other. Giving an example of medical training colleges, we train mid-level diploma courses, clinical medicine, nursing, laboratory technologist, pharmacy, and public health. And from there, we know that there are courses that run across all the disciplines. For example, anatomy and physiology, things like IT or information technology, research methodologies, all the professions actually need them, and even the basics like first aid and survival skills. All the students in the college require them. And if they are put together to teach them together, they learn more about each other, what a nurse can do, what a clinical officer student can do, or what a laboratory technologist can do. So from here, they will actually lead to improved patient-centered care, because at the end of it all, we are looking at the global trend, which is the patient-centered care. So interprofessional learning is when two or more professions learn from, about each other to improve collaboration and quality of care. And collaboration here just means the interaction, the willingness to cooperate, to coordinate. Okay? And globally, IEAHPEA is actually recognized as an innovative approach that can tackle global health workforce challenges and improved patient-centered care. Most of our presenters have talked about shortages in their areas, and we know that if many students are put together and they are taught by one, and there's that collaboration and coordination, then we will even tackle the shortages. Then the patient's care will be improved, the health care will be improved because there's teamwork. There's no shifting of blame in case of a problem or a bad incident. Background. In Kenya, health professionals are trained independently. They are in silos. Like if you are a nurse, you are trained as a nurse. And you are equipped to function in your own discipline, so that interprofessionalism is only realized at the point of care. So when we meet in the wards or at health facilities, that is where we come together and know that this is a nurse, this is a doctor, this is a clinical officer, this is a nutritionist, or all that. So it is only realized at the point of care. And this one has resulted into minimal collaboration. It's like there's no teamwork. Everybody does what he knows best, and there's no much consultation. So the teamwork is low, and then there's also medical errors. For some time, there's shifting of blame, who delayed who. Like a clinical officer in outpatient department delays in referring a patient to a specific clinic, and therefore there is delay in handling of this patient, and the patient might die, or there is progresses badly. So that shifting of blame and minimal collaboration is as a result of, I think, poor interprofessional education. So the objective of this study was to determine the level of collaboration of trainers and students on interprofessional education. Specific objectives were to determine their awareness. Are these people aware that there's something called interprofessional education? And also to establish the views. How do they view interprofessional education? And then establish practices. Is there IPE or interprofessional education in Kakamega Medical Training College? Methodology, it was a descriptive cross-sectional survey which targeted teachers and senior students at the Medical Training College, Kakamega. And this was deliberate because they had the information that the researcher wanted. And it was a purposive sampling technique, and the sample size was 100. So whatever was revealed in the research was that students and teachers are actually aware of IPE. They can define it, they know it exists, they know it is important, or it has multiple benefits. 90% do not practice. And even those who say they do practice, it is multidisciplinary teaching. And there's a thin line between multidisciplinary and interprofessionalism, where multidisciplinary is putting several disciplines together and teaching them. So there is a thin line between them, while interprofessionalism is about collaboration, coordination, the willingness, and more to do with that. So again, the research revealed that there are various benefits, and these are some of the benefits that were arrived at, that when students practice or they undergo interprofessional education, then there will be improved communication. They'll know that each one of them is important. We have seen the hierarchy that so and so and so and so, and this is more important, the other one is low, and okay. So when interprofessional education is taught or the method is used, then there will be improved communication and even whom to consult when. There is also teamwork, and each one of them knows that he's a team player, and therefore it will lead to quality health care, which is the center of all this. There is also collaboration. That means there is coordination and willingness to participate, to interact. So those are the benefits that were realized or were mentioned by both the students and teachers. Students mostly said they will have improved communication. So they also said that although it exists and it is good and it has those benefits, but there are challenges. One of them, especially mentioned by the teachers, was lack of curriculum guide. Cannot wake up and start teaching, okay, interprofessional education. It is not in our curriculum. So what happens? Then there are no defined outcomes to the same. What are these products? How will they be? Okay. Then lack of faculty development. They need to be trained. The teachers need to be trained on how to handle this interprofessional education. How will they assess? How will they evaluate? How are they going to implement? Then the different roles of the trainees. Each one is trained differently, and because of their identity, they feel that if they are trained together, it's like they are losing their identity as who they are. Then the roles they are supposed to play may be a hindrance to this. Then the depth and duration of training. You know that even if each one of them is learning about anatomy or physiology or whatever, then the depth differs. You know, different curriculums have different depths of training, and therefore it may be a hindrance to that. And this can only be solved if the curriculum is actually tuned to the same. The conclusion and recommendation, it is that IPE or interprofessional education is not actually practiced in KMTC Kakamega, that is, and some of the recommendations are that we need to develop our faculties so that they know how to implement, how to evaluate or assess IPE so that it moves forward. Again, we also need to redefine the outcomes. And more researchers, like when you look up in the internet, it is a gray area. There are very scanty researches done, especially within us, about interprofessional education, how it has worked, and the implementation and evaluation, or where we are now. Most researchers are outside the country, and of course, it is in more advanced stages in other countries. But around us, interprofessional education, the literature or the documentation is very low. Thank you for listening.
Thank you very much.